A bit of good news in the fight against Ebola this morning. The third American missionary who came down with the disease has been released from a Nebraska hospital. In West Africa, however, the crisis grows by the minute. The disease could potentially infect more than 1 million people by 2015. That's why the U.S. and world leaders are joining together to fight the illness. Lori Johnson has the latest.
The scene is all too common. West Africans in agonizing pain outside overcrowded, understaffed treatment facilities. Sometimes patients are admitted while others die waiting.
It's kind of pathetic, to come and then see patients dying all on the ground and nobody to even see them.
The death toll, which doubles every 3 weeks, now stands at 3,000. The World Health Organization says it's actually much higher because of unreported cases.
If ever there were a public health emergency deserving an urgent, strong and coordinated international response, this is it.
Speaking to the United Nations, President Obama pledged 3,000 American troops and $1 billion to build treatment centers. But the U.S. will not provide the 8,000 healthcare workers needed to staff them. The State Department created a new position, Ebola coordinator, and named Nancy Powell, the former ambassador to India, to the post. Her mission, bring other countries into the fight. Meanwhile, Boston physician Dr. Rick Sacra received a clean bill of health after contracting Ebola last month.
Ever since I committed my life to Jesus as a young man, he has loved me, stood beside me, and given me his grace. But the outpouring of grace that I have experienced during my fight with Ebola has been especially generous.
Sacra's treatment involved an experimental drug called TKM Ebola. That, plus blood transfusions from Ebola survivor Dr. Kent Brantley and other medications, helped strengthen Sacra's immune system. He became infected in West Africa, where CBN's Operation Blessing is helping to prevent further spreading. Workers are providing chlorinated water for disinfecting, medical supplies, and partnering with local Christians to teach hygiene.
And so it's church volunteers that are forming these Ebola prevention teams. So they're wearing T-shirts, going out into the communities, being the boots on the ground, really helping spread the message of prevention.
Health experts say while Ebola is not likely to spread to the United States, the possibility increases each day the virus rages out of control in Africa. Lori Johnson, CBN News.